Hello everyone. Today I am going to answer the question, what are pediatric osteoporosis and its treatment options? So firstly, what are pediatric osteoporosis? Pediatric or juvenile osteoporosis is a condition that weakens the bones, making fractures more likely to happen. It is most common later in life, especially in women after menopause. But it's possible for children and teens to develop juvenile osteoporosis. This affects children within age groups of 8 and 14 years, between age 8 and 14 years. It's a serious problem because it strikes when a child is still building up his bone strength. You build about 90% of your bone mass by the age group of 18 to 20 years. Losing bone mass during prime bone building years can put someone at risk of complications such as fractures. Coming down to the next slide, that is types of juvenile osteoporosis. There are two types, that is secondary osteoporosis and idiopathic osteoporosis. So secondary osteoporosis means that another medical condition is to be blamed. This is the most common kind of juvenile osteoporosis. Some of the diseases and causes that can lead to osteoporosis in children includes juvenile arthritis, diabetes, cystic fibrosis, leukemia, celiac disease, osteogenesis imperfecta, that is brittle bone disease, homocystinuria, that is a genetic metabolic disorder, hyperthyroidism, hyperparathyroidism, Cushing's syndrome, Malabsorption syndrome, Anorexia nervosa or other eating disorders, kidney disease. Sometimes juvenile osteoporosis is a direct result of a disease itself. For example, with rheumatoid arthritis, children may have lower than expected bone mass, especially near arthritic joints. The so-called female athletic triad can also lead to osteoporosis in young women. It's a syndrome of three conditions that include lack of energy caused by poor eating habits. Certain drugs can also lead to juvenile osteoporosis. These can include chemotherapy for cancer, anticonvulsant medicines for seizures, or steroids for arthritis. If any child has any of these symptoms, it is advisable to get their bone density checked. Next slide is about idiopathic osteoporosis. In this type of osteoporosis, the doctor does not know what caused the disease. This type of juvenile osteoporosis is much less common. It is more common in boys than in girls. It usually starts just before puberty. The child's bone density may mostly recover during puberty, but still quite, not quite be normal when bone mass peaks as an adult. Next, coming to symptoms. The signs and symptoms of juvenile osteoporosis includes pain in the lower back, hips, knees, ankles and feet, trouble with walking, fracture in legs, ankles or feet. Now coming to diagnosis. Bone density scans are the most accurate way to detect lowered bone mass, but they need to be interpreted carefully to make a clear diagnosis in children. Coming to the treatment options, doctor will make recommendations based on the cause of child's juvenile osteoporosis. If it is caused by a disease, doctor will first treat the cause of osteoporosis. If medication is responsible, the doctor would recommend other medicines or say medicines at lower doses. None of the osteoporosis drugs that adults can take are approved for use in children. It is very important to protect child's bones from fracture. He may need to use crutches or other supports. Avoid exercise such as contact sports that could cause a fracture. All children, including those with juvenile osteoporosis, need a lifestyle that helps build healthy bones. This includes a diet rich in calcium, vitamin D, and protein, and as much safe physical activity as possible. Avoid use of caffeine. Every year they need to get their bone density checked. Thank you very much. And if you have any doubts or queries, You can write comments and I'll create separate videos clearing your doubts. If you like this video, kindly click the like button and also subscribe to this channel. Thank you very much. Have a nice day.